Bismillahirrahmanirrahim. Now let's look the stages of labor. There are four stages: the first, second, third, and fourth. In the first, what is happening? There is the effacement and the dilation. In the second stage, it's the fetus delivery is happening. In the third stage, placenta is delivering. Okay, so there is delivery of placenta, delivery of fetus, and here is the cervical changes. Okay, in the fourth stage, which is 2 hours after the postpartum care, it's just observation. I mean, a baby has been delivered, placenta has been delivered. You should take care at least 2 hours after the delivery. Okay, so this is just observation stage. So you know better, in the first stage we have divided into latent phase and the active phase. So in the latent phase, the dilation is more than 3 centimeter. In the active, it reaches up to the 10 centimeter. Okay. And here you can see the effacement of the cervix, so lower segment become thinner, and also the opening is increasing. Okay, so this is the dilation. In primigravida and multigravida, I mean primary first delivery woman, so 1 centimeter per hour dilation, more than 1 centimeter per hour, while in the multipara it should be the more than 1.5 centimeter. If it's less than this value, mean the dilation is not normal, so we need some measure. And the duration for the first stage is in the primigravida, latent should be less than 20 hours and the active should be less than 4 hours. Okay, while in the multipara it should be less than 14, in the active phase should be less than 2 hours. Okay, so this was the effacement and dilation. Let's look at the fetus delivery. So these are the cardinal movements which we memorize by this mnemonic defier. Mean there are descent, engagement, flexion, internal rotation, extension, restitution with the external rotation, and the expulsion. Okay, so let's look at here what is happening. Here you can see the head is floating, meaning it's not engaged. It's before engagement, it's above the ischial supine. So this is the stage 1. What is happening next? Now it's engaged. Okay, and what happens next? It's engaged. You can see it's a descent, and there is flexion. Flexion, how you can define flexion? The chin is on the chest. Chin is on the chest. It's a flexion. So engaged, descent mean it was present here. Now it reaches here. Descent and engaged and the flexion. So this is these are first 3 movements. Okay, and the next what you can see the internal rotation. You can see here what is happening here. So how the internally rotated, so like this. Okay, so there is the internal rotation of the head. If you look at it, it's anti-clockwise. Okay, so anti-clockwise rotation. So this is the next stage, 4th. In the next stage, what is happening? So now the extension, baby is extending his head. Okay, so it's extended. So this is just look like a crown. Okay, so cervix with the crown, or just like head with the crown. Here is cervix with the crown. So this is crowning. So it's a very important stage. Okay. Because we have take some measure at this point, we'll come to later, but what you can see here once again, so the engagement, descent, flexion, internal rotation, okay, extension. What is happening next? So there is a restitution. Okay, so where the fetus is trying to untwist his neck. If you look at here, so head is obliquely placed. Okay, so now what is happening? So it's now it's become right angle with the shoulders. So head is right angle to the shoulder. So it's with the help of the external rotation. If you see here what is happening, so it was like just like this. Before that, it's you can see the head is extend. Now it's you can see it's clockwise, mean the external rotation. Okay. And the last step is the delivery of the interior shoulder first, posterior delivery later. Okay, first interior shoulder and then the posterior shoulder. Okay, one more time. So floating, engage, descent, flexion, internal rotation, further internal rotation, extension started, and the restitution with the external rotation, and the right shoulder out, left shoulder out. Okay, so one more time. In the floating, engage, internal rotation, the extension, the restitution with the external rotation, and the interior shoulder out, the posterior shoulder out. So these were the cardinal movements of the fetus during the second stage of labor. Okay, so it's not dependent upon the living baby. So sometimes live births, if or the intrauterine demise, so dead baby also undergo all these movements. Why fetus undergoes all these cardinal movements? Because better there are different diameters for the fetal head and different diameter of the maternal pelvis. So the fetus try to accommodate in such a way that his largest diameter of head should present at the largest diameter of the maternal pelvis. If you look at here, so this is the largest diameter of the fetus head vertigomental, which is 13.5, and this is the smallest diameter, which is submentobrachmatic or occipitobrachmatic. So these are 9.5. Okay. Here you can see the diameter of the pelvic inlet and the pelvic outlet. In the inlet outlet, they are quite opposite. If you see here, the interior posterior is 11, here the transverse is 11. Okay, while at the outlet the interior posterior is 13, here is the transverse is 13. So that's why the fetus try to present its largest diameter in the inlet and just try to accommodate in a transverse way. Okay, while at the outlet, he tried to change his position, so his largest diameter should present interior posteriorly. If you look at here, here is the pelvic inlet level, here is the pelvic outlet. So this is the fetus, so this is the longest axis of the fetus. Okay, so that's why the fetus try to flex his head to avoid the longest axis come in the interior posterior. So it's just like, if you look at here, just like that. Okay, here you can see this is the pelvic inlet. Okay, this is the pelvic outlet. So fetus try to avoid the pelvic inlet, to avoid the interior posterior axis for the vertigomental. So he maintained his head by flexing. Okay, so he flex head. So this, you can see this long axis does not come interior posteriorly. Okay, so this is the first action by the fetus. Here you can see this is the pelvic inlet, this is the pelvic outlet. Okay, so this is the vertigomental, which is the longest diameter of the fetal head. Okay, so the fetus flexes his head to avoid the interior posterior diameter of the pelvic inlet, because it's a shortest. Okay, while he prevent this the longest diameter from the interior posterior. Okay, so his flex head. So now you can see the longest diameter is not coming interior posteriorly. Okay, so this flexion actually follow the two-arm lever theory. Okay, where you force one arm, the other arm goes forward. Okay, so by the flexion of this side, what is happening? So this chin is on the chest, so this side the other arm descend. Okay, so they come forward, come down, or you can say. Okay, just like here. So this is the central. If you move this head in this way, so this fetal descent occur. So two action are occurring. So one, the fetus is avoiding the interior posterior diameter. Second thing, in the descent of this side. Okay, and here you can see now the fetus is come out of the pelvic inlet. Now he try to rotate his head. Okay, so why? Because now he want to come in the interior posterior diameter. Okay, which is the longest diameter at the pelvic outlet. Okay, so you can see when he is coming out of the pelvic outlet, so his longest diameter, so which is this, so this is coming in this way. Okay, this is the flexion, internal rotation. At the crowning, you should try to avoid the extension before crowning. Okay, allow the extension after crowning. Okay, because if the extension occur before the crowning, what will happen? So there would be the vulva extension occur via the occipitofrontal, okay, which is a larger diameter. Okay, so we try to allow the extension after crowning. So in this way, what will happen? So the extension of vulva occur by the sub occipitofrontal the axis, or you can say diameter, so which prevent from the perineal injury. Okay, so perineum tear can occur if the extension occur before the crowning. Okay. The next is the restitution, external rotation, where the fetus try to untwist his neck. Okay, so it is almost 1/8 of circle rotation opposite to the internal rotation. Okay, so in the this is the delivery of interior shoulder, and while in the delivery of the posterior shoulder, what is helping? So number one thing is this shoulder. Okay, so which is fixed over here. So other is the contraction of your supine. So supine contraction allow the expulsion of the posterior shoulder. Okay, so the interior shoulder is fixed over here, and the contraction of supine help the posterior shoulder delivery. So other body easily come out. So these are the cardinal movements. Okay. So here is the summary what we have discussed. So you can read on your own self. Here is also the chart or table which explain all these steps which we have discussed already. Okay. And if you look at the time period, it should be less than 2 hours in the premi, and it should be less than 1 hour in the multipara. Okay. So if you give the anesthesia, epidural anesthesia, so which increases the slow down the progress. So that's why. So you consider less than 3 hours, and multipara it should be less than 2 hours. Okay. So this was the second stage. Now come to the third stage where the placenta is delivered. So what is happening? First step is the placenta separation. So how you can define the placenta is separated or not? So when the placenta is separated, so there is a gush of blood. Okay, so gush of blood is coming out as the placenta detaches from the its bed. Okay, so gush of blood and the elongation of cord. So cord is elongated, and the suprapubic bulge, you will see the suprapubic bulge. Okay, so these are the sign for the you can say placenta separation. Then you see the descent of placenta, mean placenta is coming down, and the placenta expulsion. Okay, so three step: placenta separation, placenta descent, and the placenta expulsion. Placenta expulsion has two mechanisms, Sachels and the Duncan. So Sachels which is central, and the Duncan which is the marginal. Okay, and if you look at here, the Matthews Duncan, which is the placenta the expulsion is occurring from the margin. Okay, while in this case you can see it's a central. Okay, so this is known as the Duncan, and here you can see the marginal. Okay, here, so what is happening is you can see here is vagina, here is placenta. You look at the cord. So if the length of cord is increasing, mean there is the descent of the placenta. So like here, so if the length is increasing, so mean there is a descent of placenta start. Okay, so it should be within the 30 minutes. And here you can see central. Okay, which is coming just look like a umbrella. Okay, so umbrella, inverted umbrella. So while in the Matthews Duncan, so it's a marginal, so which is just like a button. Okay, so just like button is removed. So here is the marginal, and here is the central. And you can see here in another pictures. So such a central. Okay, which just look like umbrella, and here you can see the marginal. Okay, so Matthews Duncan. So both you can see here. Okay, so this is the placenta delivery. Okay, so for the what is importance of these two mechanisms, if it's follow the Matthews or Duncan, so there is more bleeding, and it's a marginal, and there is a high incidence of the membrane retention. Okay, so mnemonic is the M, Matthews Duncan. More bleeding, it's a marginal, and there is a high incidence of the membrane retention. For the sexual, so you remember the S and C. S some bleeding and it's a central and it's a common. So it's a 80%, it's a 20%. Okay, so there less bleeding, more bleeding. Okay, some bleeding, or you can say here is a more bleeding. Or if you rename them by the Duncan, so you can call it the diffuse bleeding, D for the side, or you can say marginal. Okay, and the N mean membrane retention. Okay, so this was the delivery of placenta. Okay, and the time period in the gravida or the multipara, in both it should be less than the 30 minute. Okay, the fourth stage is to postpartum care, which is just observation for the complication, and you have to look at the fundus and its uterus, what is happening to uterus, it's normalizing or not. Okay, so here you can see the method, the best way to palpate the fundus after the delivery of the placenta. You can palpate it within 2 hours. Okay, and check out what is happening. The uterus, its size is decreasing or coming down or not. Okay, what you should know about the first stage, you should know the duration, its mechanism, and the goal, what we want to achieve, and what we can do if for achievement of those goals. Okay, and the durations you know better. In the primary gravida, you should differentiate from the multigravida. Okay, less than 20, less than 14, less than 4, and less than 2 hours. Okay, and in the mechanism, there is a uterine contraction, meaning true labor pains. Okay, and there is a cervix effacement and dilation, which is divided into two phases. Okay, so the effacement and the dilation. Okay, and we have divided into latent and the active phase. Okay, in the latent, so the dilation is more than 3 centimeter, while in the active it reaches the 10 centimeter. Okay, what are our goals in the first stage? We should make the strong efficient contraction. What does mean by strong efficient contraction? 3 contraction within 10 minutes. Okay, and each lasts for 1 minute, and the intensity should be 40 to 60. Why it is important strong and efficient contraction? Because it's important for the dilation and effacement. Okay, so which can cause the dilation. Okay, and the normal criteria is 1 centimeter per hour in the primary gravida and 1.5 centimeter per hour in the multigravida. What can we do to achieve these goals? So to increase the contraction, we give the oxytocin and the artificial rupture of membrane. And if the contraction are too heavy, you want to decrease the contraction, you should stop the oxytocin and give the epidural anesthesia. Okay, and rehydrate the woman. Okay, so if you see the contraction are too severe. Okay, so to increase contraction, artificial rupture of membrane or the oxytocin, or to decrease the contraction, stop oxytocin and give epidural anesthesia and rehydrate the woman. Okay, and in the second stage where the delivery of the fetus is occurring. Okay, so duration less than 2 hours, less than 1 hour in the multigravida, and these are the movements, cardinal movements. So take some time to revise all these cardinal movements. Okay, one by one, try to identify all the movements. Okay, here is also an animated version where you can see all the cardinal movements are occurring. Okay, so in the goal, as I mentioned, so allow extension after crowning to descend vulva by the suboccipitofrontal, not by occipitofrontal. Okay, so it's prevent the perineal tear. So how we can do by the retention maneuver, so which support the perineal. Okay, so if you see here, if you put your one hand below the chin, so if you do not allow the extension before the crowning, so mean after crowning, so the extension should occur. So we put one hand over here, other over here. Okay, so we are preventing the extension before crowning. So after the crowning, so the extension should occur. So next step, we try to externally rotate the head. Okay, and then delivery of there is delivery of the head, there is delivery of the shoulder. Okay, now the third stage, which is placental delivery, you know better, we have discussed their duration, mechanism. Okay, and here is a comparison chart. Okay, and what is our goal? Our goal is to minimize the bleeding. It should be less than 500. So otherwise we name them the, if it's greater than that, we consider it the postpartum hemorrhage. So it should be less than 500. What we can do, we do the active management. We should put our hand and remove the all the placental component which are present in the uterus. Okay, although itself uterus is contracting, so which help to remove the placental and all its the membranes. So, and you can also help by doing some active management. Okay, and use of ecbolics like the ergometrin and the oxytocin, which contract the uterus and expel the all the component. Okay, so this is the summary of first, second, and third stage. And fourth stage, just two are the observation. That's all about the normal labor.